diagnosed with an eye turn by an optometrist. I had to wear glasses, I had to wear a patch, and eventually I did have to have eye surgery. So I spent a lot of time in different optometry clinics learning all about the eyes. And so as I got a little bit older, I really started focusing on what I could do with that. And so in college I decided that I would look into optometry as my career. There's a big misconception out there that you only need to get an eye exam if you're not seeing well. Well, I want to educate my patients that, it's really about that yearly eye exam. It's not always about how well you can see. There are many eye diseases out there that don't have the first symptom of vision loss, and so those can only be detected with that yearly eye exam. When we do a comprehensive eye exam, we're dilating the patient, we're looking for overall health, we're looking for any diseases or abnormalities that may come up. Especially in older patients, there are a lot of age-related eye diseases that can be detected during a comprehensive eye exam, such as cataracts, macular degeneration, or glaucoma. Kids tend to overfocus their eyes a lot, and that can cause eye strain, trouble reading, difficulty in school. And so by dilating their eyes, we're able to get a really accurate prescription and fully assess their focusing ability and their ability to use their eyes together. My approach to patient care is to make my patients feel comfortable. A lot of times I have young kids who are really scared. There's a lot of equipment in here and they're a little bit nervous. They don't know how they're supposed to see, and so they feel like it's a test and they might be getting something wrong, or they're afraid to guess and tell me what they see. So I really want to make my patients feel comfortable. I also see older patients who maybe haven't had an eye exam in years and they're nervous, they're not seeing as well, they're not sure what's going on, and so I really want them to make them feel comfortable. The eye exam isn't a test, there is no wrong answers. I know everyone thinks one or two, am I going to pick the wrong one? But there really isn't a wrong answer, and I really want my patients to feel comfortable, open up to me, tell me what kind of ocular symptoms they are experiencing, how their eyes affect their everyday life. It's really about a conversation between me and my patients so that they feel comfortable and I really understand what's most important to them throughout their life, how they're using their vision, how they're using their eyes, and how that's affecting their everyday life. Right now I'm redoing a house, so I don't know if there's ever any unwinding. I've been going home and painting and patching, but when I can get away from that right now, I do like to run. I like to get outside as much as possible. As an optometrist, we're in dark rooms all day, so at the end of the day, if I can get out and be outside, I enjoy that. I'll run all year. In the summer, I like to bike if possible, so really anything to get me outside at the end of the day. So my patients and my patient success stories keep me going every day. It's great to see a young kid who came in, who got their first pair of glasses, and now they're able to see a lot better. Mom and dad report their grades are up since getting the new glasses. Or maybe it's my older patient who came in for an eye exam because they weren't seeing well and they were diagnosed with cataracts, and we get them set up for cataract surgery, and then after that, they're able to do so much more throughout their daily lives because their vision is so much better after cataract surgery. So I was on the United States ski team. I was a member of the freestyle aerial team. So I was a gymnast growing up. I didn't actually know how to ski at all. I didn't learn how to ski till I was later in high school. But I was a gymnast, and so aerials has a big gymnastics background. Aerials is a sport where you go up the big tall ramp and do flips and twists and are judged on that. And so I grew up a gymnast. I eventually learned how to ski, and that's kind of how I got into aerials. This opportunity came up to open a clinic in downtown Fort Wayne to provide eye care. And this was incredibly important to me because I believe it is most important to have not only quality but comprehensive eye care available to everyone. We're able to provide glasses in a wide range of selection for both children, women, and men. I wanted to make sure that everybody who came here would be able to find a pair of glasses that they'd be happy to wear. We started this clinic from nothing, and I've had so much support from the entire clinic getting it started up and running, and so it's been very successful. I also think the patients make this place. This is what's the most important to our clinic. Without our patients, we wouldn't be here. And so I love seeing the wide variety of patients that come in our doors every single day, hearing their stories and their background, and getting to know them on a more personal level. What's so unique about Neighborhood Health Clinic is that we have medical here, we have dental, we have optometry, and so I can refer to my colleagues, I can bounce ideas off of them. We're able to provide complete comprehensive health care here at Neighborhood Health Clinic. I may have a diabetic patient that, hasn't been seen in a while, and so I can refer them up to medical and they can get their diabetes under control. Or vice versa. Every diabetic needs a comprehensive eye exam each year. So if the medical provider has seen that the patient hasn't had their diabetic eye exam, they can just walk them right down to our clinic and we can get them scheduled. So being able to have all those services in one location, I think really does make Neighborhood Health Clinic very unique. I choose Neighborhood Health Clinics for the patients.